Hello, I'm Miriam Damián-Jacobo from Public Health 336, Section 500, and I'm going to be focusing on Chapter 4, Complementary and Alternative Medicine. So in this chapter, I learned about the use of herbal remedies, how they treat a number of diseases, and how much of the medicine we use today originated from herbs. I found it really interesting how some cultures use certain parts of the herb, and then other cultures use the whole herb. And I liked the theories that they had, and once again, how different cultures dealt with similar issues in various ways. I really liked acupuncture, and how different points were used for balance and to bring qi to specific parts of the body, similar to how herbal remedies is used to restore homeostasis by treating the cause of the disease. So they're both about treating the cause of what's happening instead of the actual disease, and I thought that was really interesting. So upon reading this made me question, how could we standardize the doses for alternative medicine? So different types and brands can create the same effect, and how could this stop overdosing? Because herbal medicine, as we saw, has a huge market. So how can we regulate this for the public? And this came since I read that herbal medicines are regulated as dietary supplements, meaning they are not subject to the pre-marketing regulations clearance required for drugs. So the first things I thought of when I thought about this is maybe just having stricter quality control guidelines can help achieve this. But after reviewing some of the literature, I found that there is a lot more that needs to be done, of course, to standardize this type of alternative medicine. Specifically, I read the herbal and alternative medicine article, and I found that there is a large risk with herbal remedies being overdosed, with toxicity being a huge risk for this, which toxicity has a lot of issues with your body, because you're just taking too much of the herb because you don't know what the standardized is, in the same way you do with the actual medicines that are over the counter. So some solutions that I found focus on making it receive clearance the same way drugs do. So going through a pre-clearance, pre-screening, having more quality control and testing for them, putting more time into clinical trials just to see what the effects of the drug actually are before just allowing the public to have them. Sharing the possible risk of herbal remedies, because a lot of people only view this as a safer option without looking too much into the actual effects that they're doing to your body. So making this information more accessible to the public is a great way to just reduce the risk of toxicity and overdosing in herbal remedies. And then a huge part of this is making sure that the active ingredients are known and studied, like I said, in the clinical trials, and having clear labels on what is contained in each specific herbal remedy. Because since it's not regulated, it's not very clear in there how much the dosage is or what the dosage should be. So it's very easy for people to just take more of it because you don't feel the effects as quickly. So just having clear labels is a really great way for the public to be aware of what they should be doing. And the only way to get clearer labels and of the specific doses is to do more testing and more regulation before they're put on the shelves for consumption. Thank you.